Good morning, I'm Kurt Ludlow. We're following the very latest on the COVID-19 pandemic. The U.S. now has the third most confirmed cases of any country in the world. Across the country, the number of confirmed cases continues to rise. More than 46,000 people have been infected in the U.S. and at least 586 people have died. Most of the deaths have been recorded in New York, Washington State, and California. Worldwide, there are now more than 381,000 confirmed cases with more than 16,000 people around the world who have been killed by the virus. However, more than 101,000 people have reportedly recovered. The first rapid diagnostic test for coronavirus has been approved by the FDA, but it's not expected to be available for at least a few weeks. Sinclair medical reporter Liz Bonas shows us how labs are making changes to try to come up with quicker results.
We did, I think, 6 samples on Monday, 20 on Tuesday, 43 on Wednesday. I think it was about 86 on Friday.
Inside this laboratory in Covington, Kentucky, Tony Remington says his employees are learning, along with the rest of the world, that when it comes to testing,
but we've been trying to really focus on those that need the testing most.
Weeks ago, they applied at Gravity Diagnostics here and were approved by the Food and Drug Administration to assist and analyze tests for COVID-19. But since it's a new virus, it's also a new process for everyone involved, which slows the process down.
We've been reporting results back that day, but I have to say, usually we're about a 48-hour turnaround time.
The FDA did just approve the first rapid diagnostic test for the coronavirus by a company in California. Others are in the works. But Remington says it will still likely be weeks before they are shipped and able to be in the hands of those on the front lines. The test approved can detect COVID-19 in about 45 minutes. Until more rapid tests and labs can assist in delivering testing results.
I mean, our end goal would try to get up to over 1,000 per day. Ideally 2,000. We'd have to see kind of staffing, instrumentation. Right now, what we've done is we've modified the CDC protocol in order to use for our equipment. We're still in the process of trying to modify that further to kind of increase our capacity.
Employees such as JP Canner say they feel a huge commitment to provide what those on the front lines need to provide proper treatment. Remington says his team now only requesting samples that match new guidelines. Testing for the virus should only be conducted in those who are showing symptoms and for which it would change the course of treatment.
I got to stress, Liz, is the capacity we have. We're being really, really careful who we work with and who we test because we know the demand is higher than the supply.
But in all this, he says, perhaps the thing that he is most proud about isn't just the testing process, the learning, the new information. It's actually in those performing this test.
Meaning the testing analysis done in his laboratory?
Yeah, we haven't had anyone opt out. Reality is you're trying to, what are they going to eat? Do they have enough toilet paper at home? We're trying to help our employees outside of work so they can focus on work.
Reminding all of us that quiet heroes, like so many others each day, play a small part in a very big, much needed worldwide solution. I'm medical reporter Liz Bonas reporting.
Home testing kits are also being developed, but none of those so far have been approved for use by the FDA. A new app is being tested in the D.C. area to help identify potential coronavirus symptoms and track the cases. It's called MimiRx. Low-income seniors get tablets preloaded with the app and free Wi-Fi. The app can be connected to medical devices, including one that measures the amount of oxygen in the blood. Then it uses an algorithm to identify likely signs of the virus.
We don't want people running out here trying to go to clinics and to the hospital, etc. right now.
This is all part of a $200 million partnership. That app is already available for free. Developers hope if the program works well, it would cut back on the number of people going to a hospital for testing. And the world's largest spirit manufacturer is trying to help with the fight against the coronavirus. Diageo, whose brands include Smirnoff, Johnnie Walker, and Guinness, plans to donate enough alcohol to make 8 million bottles of hand sanitizer. The 96% alcohol mix will be distributed to companies around the world. Hand sanitizer will be sent to healthcare workers in the U.S., UK, Italy, and other countries. Stick with us for continuing coverage and breaking news on the coronavirus outbreak. I'm Kurt Ludlow.
This COVID-19 update on Fox 29 is brought to you by Netflix.